I want to say thank you very much for being invited. This is my first time in the World Cancer Day celebration. And it's a situation where, as you've heard, NHIF has been mentioned a lot. So I just want to probably demystify NHIF and its role, because of late it has been having accolades in local sittings like this and bashings in the media. And I think it's important to really get to know what NHIF is, what role it plays, and who we are, and what is our calling in as far as the country is concerned. First and foremost, NHIF was given the role of being the flag bearer for universal health coverage, which is one of the four pillars for the agendas that the president wants to leave in his legacy. And for it to do that, it had to transform. And for that transformation, it looked at four areas. One was legislation, and now we have the new amended NHIF Bill Act, which transformed NHIF from National Hospital Insurance Fund to National Health Insurance Fund. And now we are in the process of amending all the regulations so that we can be able to deliver universal health coverage. Universal health coverage, in essence, means that every Kenyan should be able to access quality, affordable health care without suffering financial loss. And as such, NHIF steps in for all people who become members, so that when they have a sickness, that sickness, particularly if it has a huge financial burden, they're not able to suffer financial loss because of it. So in terms of legislation, we now have transformed NHIF, and now we're having regulations that will require all Kenyans to contribute something into their pocket. And we are having stakeholders discussions as we speak. And one of the things that has been happening, there's been this discourse and this discussion between particularly the Federation of Kenya Employers and the KOTU, the workers' representatives, on how much should be contributed towards healthcare. Now, the world standard is for you to be able to enjoy health coverage, it's normally 10% of your income to enjoy total universal health coverage. Our proposition has been and has been passed and is going into the regulations, 1.7% for the employee and an equivalent for the employer, which is 3.4%, which means if you look at where we sit, there is still another 6.4%, 1.4, that 3.4, so another 6.6% that needs to be covered. And that needs to be taken care of if we would get to the world standard that is given by UN. So I think it's important for us, as we take this debate forward, we look at the milestones that have been achieved by where NHIF has come from and what milestones we want to achieve so that we can ensure that everybody can enjoy health coverage. And we've heard a lot of explanations here on how it has transformed. And just to give you a bit of statistic, in the year 2020 to 2021, our total payout for health coverage was 54 billion. Of that, the total payout for renal and for dialysis payout was 3.84 billion, totaling to 7.1% of the total of the expense benefits, being the fourth most expensive benefit for the fund. At the same time, we were able to do 285,000 dialysis. Now, those 285,000 dialysis, I can tell you for a fact, is that probably 95% of them would not have been successful if NHIF hadn't existed. Now, this is a journey that we want to take. We want to take a journey where we want to make sure that it's not only in the renal, it's not only in the oncology, it's not only with the issues that are coming up, including the new diseases that are coming up, that NHIF should have the capacity to deliver. But for us to be able to do that, we have to partner with the government, who have been so kind. They've now put in 1 million non-affording and are intending to put in another 1 million non-affording families so that universal health coverage can be achieved. In total, because we have the haves and the have-nots, we would want to urge the ones who have to accept to take the burden of contributing 1.7% of their own salaries towards ensuring. And many times I'm sure they enjoy the NHIF benefits, plus the employers contributing the extra 1.7%. And it's 1.7 if you're above 100,000. Before that, there are bands that go on with that. And then we also make sure that our families who cannot afford, because the government cannot only be the one that is contributing, you contribute 500 shillings per patient. Now, when you contribute that 500 shillings per family, per month, it's 6,000 shillings per year. It's able to pay 1 million shillings for dialysis. And now we are really working towards focusing on working towards transplants so that we can reduce the number of patients on dialysis. And the second thing that we've done after this is that now we are looking at the benefits packages and what Gikonyo was requesting on ensuring that there is post-transplant management, because we're already paying for transplant. We're also going to include it in that package. So mine is to say congratulations. We will partner with the Kenya Renal Association. We will partner with the Kenyatta National Hospital and all the level 6 hospitals, both government and non-government. Another item that has been coming on in the press is the issue of that in the regulations there is a suggestion that chronic illnesses will only be paid for by NHIF to public hospitals. Now, that's just a suggestion. We are still in stakeholders forum. All I want to tell you is that NHIF is following the rules of the Constitution, and there will be no discrimination between private parties and public parties. The contract that we have form two bases. One that is comprehensive, so if the private or the public providers, and I think all the public providers are signing the comprehensive benefits, we pay 100% of the costs that are there. Then there is the non-comprehensive, where people want to offer what they call premium services and charge for extra services. The non-comprehensive will be paid exactly as the comprehensive, but the patient has to top up. So the patient has to elect whether they want to go to a high premium, expensive facility where NHIF pays part of the cost, or a comprehensive package. And we've been having this discussion, and I would want everybody to make a tour of the government facilities that have now been transformed over the last 4 years. Coast General Hospital, Lodhaya Hospital, Kenyatta Hospital. There's even, and many others, because they're all the 24 facilities across for NMS, and see the transformation that has taken place, and see the quality of care that is now even competing with the premium private hospitals. So our role is to make sure that every Kenyan is able to access healthcare. I, as a chairman, for the time I'll be the chairperson of the board of our management, we will be on that single vision of delivering universal health coverage so that all Kenyans can be able to enjoy healthcare, not only on renal, oncology, or in diabetes or hypertension. And again, the difference between NHIF and private providers is that we don't have exclusions. I think the biggest risk and challenge that we had was COVID, and we've been studying it. And that was the only one that we have to find data and parameters to manage. But the rest of the covers are all covered. I don't think you see that in the private sector. So media, support us. Talk about the good things and weigh them between the good. And when you have one small incident, let it not be overemphasized. Let us emphasize the good ones. Thank you very much. God bless you, and happy World Cancer Day. And I look forward to ensuring that every Kenyan